Can I ask you, obviously these numbers are a beat here, the dialysis unit helping. What impact has COVID had over the quarter on crowding out some of the health services you offer?
Good morning, and thanks for having me. And actually, whilst you were referring to our dialysis and the generic drugs business, I believe the biggest swing is actually in our hospitals business, and there in particular in Spain. And there we have seen a pretty solid recovery of elective treatments over the course of the summer quarter, which in Spain typically marks a remarkable trough. And on that basis, we're very happy with the recovery that we've seen. But obviously, in Germany, we are not back to the elective treatment procedure volumes that we had seen in the year before. So overall, the COVID impact is still meaningful. And that is also why we're saying excluding COVID, even though that is a hypothetical perspective to have, we would have been comfortably at the upper end of our original guidance range.
Yeah, the challenge, Stephan, of course, is that we're watching the fresh announcements around lockdowns at the moment. And Spain, we know, has had very serious rises in infection rates. How is current trading going then around those areas of elective surgery?
In Spain, we have seen a September and October that has been by and large in line with last year. And also in Germany, at our hospitals, we have seen a month-over-month closing of the gap relative to last year's levels. Now, mind you, in Germany, we get government support up until the end of last month, at least. In Spain, that is not the case. But I also want to point out that I do see a marked difference between the containment measures that have now been enacted from relative to those that we were seeing in spring. This is a much more differentiated, targeted approach. And in my mind, it follows what we have commented on all along, and that is that there is severe disadvantages and collateral damage for non-COVID patients.
Stephan, that said, there's been some criticism about the need for more lockdowns. Do you think it is the right course of action to have these mini circuit breakers to try and tame the virus?
I believe we have got to optimize the entire situation. And yes, of course, the rapid growth in infections is worrying. On the other hand, when we're looking at 16,000 infections today in Germany, relative to a population of 83 million, that is still a relatively small number. I am warning, we have been warning, against paying too much attention to actually the number of infections. It is the capacities at hospital that do matter, the capacities and their utilization. We have 1,300 intensive care unit beds at our German hospital unit. About 5% of that capacity is currently occupied with COVID patients. We have said that we are prepared on very short notice to increase the capacity by 75%. So I believe we have capacity reserves and there is no need to forego elective surgery.
Stephan, I'm curious about your thoughts on a vaccine there, because we've heard from Chancellor Angela Merkel this morning that discussions are ongoing about that vaccine and who will get access first up. Is it essential that healthcare workers receive that first vaccine when it's available and it's safe to administer?
It is a very important last few words in your sentence, when it's safe to administer. I am on record saying that I'm somewhat worried about various attempts to bend the rules. And therefore, I am worried that if we allow a vaccine too early into the market and then if we then saw unexpected side effects, that it could hurt us also with the development of vaccines for future pandemics. So I would like to stick to the current hygiene rules that are, in my mind, pretty closely followed by the large part of the population, but in particular by our hospital staff. Once a vaccine is available and we can be reasonably sure, very sure, that it is actually safe, then yes, by all means, priority should be given by those who have a multiplier effect.